My name is Mike Winstead. I'm a physician with Pediatric Hematology-Oncology and bone marrow transplantation. If you ask me why I went into pediatric hematology and oncology, it sort of grew out of just a general interest in caring for children and families. And one of the special things about this field is that you really get to work with families as they're going through this terrible experience of having a child with a serious illness. Within that, I migrated toward bone marrow transplantation because I think it's an interesting kind of subset of that field. Bone marrow transplantation is still sort of an evolving field. There's still a lot of questions to be answered through research. I think the field is mature enough now that we have a very good sense of how to do certain things very well, but there are still a lot of unanswered questions, and that's an exciting part of medicine to be in. And it's also very rewarding to sort of guide a family through that process and be able to talk about the things we know, the things we don't know, the things we can predict, and the things that might happen. That's really the most rewarding part of the whole field for me. Yeah, I think the impulse to take care of children is just, for most of us who go into pediatrics, it's just kind of a sense of who you are. And I don't have a better way of articulating it than that. I think that, there's the part of medicine that's professional and research-oriented and data-driven, and then there's the other part of medicine, which is just how you feel when you walk into a room to interact with someone. And walking into a room to see a child and their family, it makes me feel like I'm glad I came to work today. Illnesses that I treat don't just happen they aren't the only thing that happens in a family's life. We have to put a lot of things on hold for a family when their child gets ill, and so we need to make sure that we have a team working on keeping the family supported. We have to make sure that we're communicating effectively, even if it's something as simple as iron deficiency anemia. Nothing is going to go as smoothly if we aren't communicating effectively. I think that's at the heart of how I see medicine and definitely how I see my role as a provider.